Many of you might have heard by now about Joe Biden's aggressive prostate cancer diagnoses. And some of you might have also heard about Peter Attia's recent video saying that if Joe Biden had a PSA test done all along, he might not have had metastatic prostate cancer. Well, with due respect to Peter Attia, I don't think he's correct. His advocacy that a $5 PSA test might have saved Joe Biden's life is incorrect. He actually leaves out a lot more in his video than what he says. And I have my notes right here, so I'm going to go by his assumptions one by one and break them down for you. So his first one is that the decision whether to screen or not to screen is based on actual life expectancy. So what he means is that we decide whether to screen somebody or not to screen is based on how much longer they have left to live. That's actually not how screening tests work. The decision whether to screen or not to screen is based on false positive and overdiagnosis rate, which lead to much higher risk of harm. So as somebody grows older, they are much more likely to have false positives and overdiagnoses. And if we start treating all of these older people who are already starting to get frail, we are much more likely to harm them than improve their life expectancy. So that's point number one. His second point is that all the tests that he mentioned, such as PSA velocity, PSA density, and free PSA, that if Joe had undergone some of those testing, we would have probably picked up his metastatic prostate cancer sooner, and he would not be in this situation. Well, the problem with this assertion is that even though these tests, they reduce some of the false positive rates, none of them actually improve life expectancy. All the data that we have is pretty much reducing false positives. I have not seen a single randomized controlled trial with any of these tests that actually increase life expectancy. Also actually, by the way, for PSA density measurement, most men do need to get a prostate transrectal ultrasound, which is not a pleasant experience. His next assertion is that he actually ignores a lot of downstream harms after PSA is done. One of the central things which I teach all medical students is before you decide you want to perform a test, you need to understand what you're going to do with the results. So if somebody has a PSA test and it comes back positive, even if it's a false positive, most of these people end up getting biopsies, which can lead to a risk of infection and bleeding. Or a lot of times people get extremely anxious, and there is data to show that even if you're serially following PSAs for a couple of years, most men end up getting a prostatectomy. Getting a prostatectomy is a major procedure. And the two biggest complications for that is erectile dysfunction and urinary incontinence. A lot of these men have a permanent urinary catheter in them after they get a prostatectomy. And then with an indwelling permanent urinary catheter comes with a lot of infections. The next point that Peter ignores is length time bias, lead time bias, and overdiagnosis bias. And I discussed all of these in one of my previous videos, false positives, real profits, if you want to take a look at that. So what that means in real life is that even if Joe Biden had a PSA done at the age of 72, which per his video was the last time he had PSAs, and it was elevated and they found prostate cancer, it probably would have been either an overdiagnosis bias or a length time bias. The problem with most of these cancers is the aggressive cancers, it is very hard to find them early. And if this cancer turned aggressive, it would have been very difficult to pick it up on a routine PSA testing. Think about it this way. Most of these cancers, they spread within a matter of weeks to months. And we do PSA tests every 1 year. So the chances that this might have been caught is extremely low. And the last point that I do want to make is, let's say if Biden underwent treatment, he might have had a lot of side effects from treatment. And that means that he might not be in the capacity to serve as our president. As usual, this is not medical advice. Please talk to your doctor before you make any decisions. Just wanted to make this short video because there's a lot of online chatter about Biden's diagnoses and people advocating for PSA tests. So just wanted to make sure that people do understand the other side of the story and the risks of harms with PSA testing. All right, take care. Thank you. Goodbye.